Hello, my name's Rhiannon Mulcahy. I'm a clinical psychologist with Psych Services. And today I wanted to talk to you a little bit about a topic that's really close to my heart, something I'm passionate about working with. And the reason I wanted to discuss it in a vlog with you today is because I often get referred clients who may be experiencing, say, depression or anxiety or substance use issues. But when we do some digging around, what we discover in their histories and their stories is that they've experienced quite a bit of trauma. And it is this that's underlying the recurrent episodes of depression and anxiety. So without further ado, I would like to tell you a little bit about trauma so that if you think that you might be experiencing this, you'll know what it is and how to get help. So what is trauma? Well, trauma is a psychological response to any kind of distressing or disturbing event. Now, we often think of it as a life-threatening event, but it doesn't need to be. It is anything that would cause our body to surge into a fight, flight, freeze mode. And so this psychological response includes not only what is going on in the brain, but also in the body. And how that has to respond and change in order to survive that event. So that actually covers quite a lot. So let's talk a little bit about what causes trauma. And so there's some really obvious ones. There's war, and there's huge accidents, medical events and illnesses. There's natural disasters, but there are other ones like bullying, racism, neglect, grief and loss. And it can also be not necessarily the person who's experiencing the event, but someone who is witnessing that event. When we talk about trauma, there are different types of trauma, and we also can treat them a little bit differently. So one of the obvious ones is those single event acute traumas, and they are often things like a car accident or being involved in a natural disaster, and that leads to an acute, rapid onset of symptoms. We also have chronic trauma, and that is where someone is exposed to repeated and prolonged traumatic events. And so good examples of that might be living in a war zone, going through a drought, if you lived in rural and regional Australia, or living in an ongoing abusive environment. We also have something that we call complex trauma, and there's quite a bit of overlap here with chronic trauma, and this is multiple traumatic experiences, often starting in childhood. And these include not always your big capital T traumas, although that may, but lots of little t traumas, neglect, abuse, witnessing domestic violence, and those sorts of things. I have a lot of clients who come along to me and they will say, look, I was fed and I was clothed, and I wasn't sexually abused, and yet I feel empty and worthless. Often when we look at that story and that history, those people did experience neglect and abuse, and it was these kind of death by 1,000 paper cuts, lots of little traumas that occurred along the way that still add up to a lot of damage. And again, some more overlap, we have relational trauma. And so, when we think of traumatic events, we do often think of, the big events like, war or accidents or natural disasters. But in actual fact, what I most see in therapy are people who are presenting with relational trauma. That is trauma that happens in the context of an attachment relationship. And it might include coercion, manipulation, exclusion and rejection, unmet developmental needs, a need for love, a need to be seen, a need to have your feelings validated. It might include abandonment, boundary violations, being put into a more adult role than a child is ready for, and also unequal power dynamics. That's to name a few. So what are the symptoms of trauma? Well, it's a lot. There's a lot. Pretty much all the symptoms of depression and anxiety also can be symptoms of trauma. But in addition to that, we have intrusive thoughts or memories, memories of the event that come into the brain or come into the mind without wanting them to. There might also be nightmares or flashbacks. People often feel like they need to avoid any reminders of the trigger to that event. People who've been through a traumatic event have a system that often remains on edge, ready for action. It's hypervigilant and hyper-aroused. Or alternatively, when someone's been in a prolonged state of hyperarousal, they can switch into something that we call hypoarousal, which is emotional numbness, disconnection. And at the very severe end of that is dissociation. And that is when someone is there but not there anymore. Other common symptoms include difficulty sleeping, and that's going to sleep, staying asleep and waking up early, difficulty concentrating, difficulty with memory in general, both short-term and long-term, remembering past events, remembering dates, remembering that you've booked a hairdresser's appointment. Often people who are experiencing trauma symptoms will have really big emotional outbursts, so anger, anxiety, and then lots of feelings of guilt, shame, self-blame, and low self-worth. I want to talk quickly about the window of tolerance, and here you can see we have a band in the middle called the window of tolerance, and that's when our brain and our nervous system is in a state where it's receptive. It can learn, it can make decisions, we can think. But when we are faced with a situation that's stressful, our nervous system will respond to that. So it can respond by going up, and you can see into escalation. I feel threatened. And it can also respond by going down. I feel flustered and I need to get out of here. And so, in the course of any day, we will move in the window of tolerance, but we may also escalate into a bit of hyperarousal or a bit of hypoarousal. When that threat is extreme, we will move even higher or lower, and we can flip into fight, flight, hyperarousal. I'm unsafe. The brain and body are flooded with stress hormones. Or if we're not able to fight or flight, we can flip all the way down into dissociation, which is I have to freeze in order to survive this situation. I'm stuck. That's important because often people will feel very confused because their nervous system either feels constantly on edge and on the go or shut down. So what are the impacts of trauma? So there are a number of diagnoses or consequences. And the first one is an acute stress reaction, and that's for anyone who's exposed to something incredibly stressful. The brain will take some time to process that, and usually though the symptoms will settle down by themselves within a month. If those symptoms don't settle down, it continues on for months and maybe years, then what we would consider that is post-traumatic stress disorder. This can also show up as depression and anxiety, and people may then engage in maladaptive coping behaviours and may experience substance abuse or addiction issues. Certainly a lot of people with traumatic experiences have major memory and concentration issues. And whenever the body is under prolonged periods of stress and the symptoms of trauma keep the body in either fight, flight, freeze, then that increases the allostatic load and can show up as physical health problems. And so we have chronic pain, cardiovascular issues, migraines, and so forth. When people have been suffering for a long time, then of course they can start to engage in self-destructive behaviours. And by that we mean self-harm and suicidal ideation. But not all is lost. We have some fabulous treatments available for trauma, and that is something that I'm passionate about, that I'm trained in, and that I offer. And so the options for treatment and recovery include psychotherapy, and there are a number of good treatment options available. So we have trauma-informed cognitive behaviour therapy. We have eye movement desensitization and reprocessing therapy called EMDR. That's a big long word. That's what I'm trained in. I love it. I'm passionate about it. And if you'd like to know more, by all means, give us a call. Often people who are experiencing trauma may need or will, it's important to consider the role of antidepressants or any anxiety medications to help. There is, of course, support groups, both online and face-to-face, to connect to other people who can share the experience, and that is incredibly important. And then there's all those strategies that we can do for ourselves that take care of both our body and our brain, which include exercise, relaxation, fueling our body, looking after ourselves. But in short, if you feel that you are experiencing some of the symptoms of trauma and that you've tried to manage that by yourself, please do not lose hope. There are options for treatment, really good options, and we would encourage you to seek professional help for trauma, and you can do that by contacting us at CQ Psych Services. Thank you. Bye.